This trainer contains no needle or drug. If you are ready to use, pull off red safety guard. If not ready to use, replace the outer case. If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
So we're here in Durham, North Carolina for the Recovery Policy Collaborative mini retreat. And there's a few of us here in person who showed up early, and I wanted to have a conversation between the four of us about what today is about. We have Shelly Weizman, who's the acting director of the Addiction and Public Policy Initiative at O'Neill Institute. And then there's Brandon George, who's the director of Indiana Addiction Issues Coalition, who advocates for addiction through public policy and education. And then there's Donald McDonald. Donald is the chief recovery officer at a company called All Sober, digital recovery support service with the aim of ending stigma and the shame of addiction and to help fund treatment for people who can't afford it. So it'll be the three of those folks and myself, Aaron Ferguson. I'm a regional impact manager for community medical services, and I'm on the leadership team of the National Drug Users Union. I hope you enjoyed the conversation that we had. And if you're able to make it to the retreat, I hope you enjoyed that. And so without further ado, I bring to you the Recovery Policy Collaborative. I wanted to get some copy leading up to today's event about what the Recovery Policy Collaborative is, how this group has formed, and move on to talk a little bit about some of the things that we've worked towards and some of the things we want to work towards in the future.
I mean, I think we're like about 1 year out from when this group started meeting on Zoom. I don't remember exactly when it was, but it was like at some point after COVID started. You know, we had this thought percolating for a while of folks who just kind of saw each other at events and conferences, wanting to see what would happen if we put our collective heads together. What could we come up with? And I think that's when we started kind of pulling the group together and just started adding more people. And I think it's been a year. So now we're finally all right, we have this retreat day. We're really gonna nail down a couple of projects that we want to do.
So I want to provide folks with some context around what was going on when this group formed. So can we talk a little bit about the conditions that were taking place when the Recovery Policy Collaborative came together?
Things were changing daily. Struggle to keep head above water with changes operationally, policy-wise. What was the policy on Tuesday may not be the policy on Thursday.
Yeah. North Carolina was in upheaval at the time, but the world was different too. Shelly, you asked me to come after coming to a conference. That's right. And seeing and with people.
Real life.
It was probably right before that, probably not too long before the world shut down. Yeah, I mean, I think what was happening? It was some federal rules had just come down, kind of changing access to treatment and trying to make it more, accessible in COVID. I know for me in my life, I'm in a 12-step recovery program. Everything had gone online. And, there was this kind of feeling that people were really isolated and this was going to be bad. For people who are struggling. And it kind of forced this, this dream that I think some of us had had for a while to actually pull the trigger on it.
And what was that dream?
I think the dream was that people are working on the same thing in different states or nationally, coming from a place of lived experience, but also from, having worked in the space a long time, and that maybe, what, again, like what could we do if we all got together and kind of came up with a vision?
I think Shelly's being modest too. The reality is she's a policy hawk, and she knew these changes that were occurring were changes a lot of us have been fighting for a long time, right? Eased access to methadone, telehealth, getting rid of the first visit for buprenorphine, some of these things that we had all wanted anyways, all of a sudden we're here. And I remember very distinctly a conversation and her saying, like, these changes have to be permanent. They can't go away. And we're not going to sit by on the sideline individually in our own corners of the country. And I don't want to say miss an opportunity. I don't know what verbiage you used, but it was, we got to make this permanent and we need to do it together.
Not only were we seeing some policy shifts that we would like to see stick around, there was a greater clarity on the underlying race and class-based health disparities that had always been present, but now it became part of the public narrative. So we could make sure that became part of this sustainable shift and this collaborative to make change.
Right. Like a lot of things were coming to the forefront. And I think the thinking was, if there's ever a time to kind of not like burn it down, but maybe burn it down, and create something, that actually is working better, this is the time.
So it seems like there was maybe a little bit of a dual function or role that the group served, and I want to explore that some more. So you mentioned people who have lived experience, and I have a question about what is the role of people who have lived experience, who are involved in policy, and how is that different from just a group of people who are interested in a given type of policy getting together?
I think one thing that I see just from my lens that's different is sit on a variety of groups with people with lived experience, and a lot of the advocacy groups, both locally and nationally, have a bunch of people with lived experience that are really passionate about some change. I think this group, comprised of the people it is not just lived experience. It's most have lived professional experience from a wide array of backgrounds, community-based but government-based, and have most significant experience either with policy or other topics related to, and can mobilize that knowledge kind of together. And I see that as much, much different than a lot of other coalitions that are out there. That do great work for a variety of reasons, but that's really different to me from this group.
So there's been a gap maybe in people who have lived experience having direct impact on policy then.
Significant gap, I think. There's people that dabble, I think, in the area or say we have a policy arm, but I don't think, not close to the scale, I think, that what we've talked about or started working on.
Right. This group is not an advocacy group.
Right. Not.
Half the people in the group work for the government, either federal, state, local. I mean, these are people that they are at the tables. And I mean, that was the other kind of focus of the group that emerged, is how do we get much more people to be able to meaningfully participate in those tables? We've kind of meandered our way into it with luck / good mentorship / whatever it is, fortunately, but how can we kind of open the floodgate and bring
the people outside with the cardboard into the table?
How can we be deliberate about that?
Yeah.
I know that my pathway to sitting at this table right now was through just a perfect storm of dumb luck and privilege, and regularly having folks in our space reach out to me and saying, how can I come get some of what you're doing right now, and would really be kind of winging it, like, well, you could do this or that or join us, but wouldn't it be fine to have a deliberate pathway to this thriving recovery and this collective impact of people in recovery and leaders in the recovery space?
I mean, it's honestly like, I think about 20 years ago, like, what would little Shelly have wanted, like, that's really what it is. And I think, random meeting of other people doing this work, also coming from a place of lived experience, there is nothing like it, like meeting somebody else who's like doing the deal in their community or at their state level or bigger. And, you know that you understand each other.
Yeah, so speaking of that understanding, what has it been like as the group has begun to form and in the backdrop of some of the worst social conditions that we've had in this country and in the midst of all the social isolation? How have things progressed and what has happened with the group's formation?
Well, I think outside of the mission, one function that it has served is we have used it as an opportunity to check in with one another and provide some mutual support through this chaotic year and to find some direction as well. I just wanted to throw that in, that you did not, waste that opportunity for this large group of people in recovery with stressful lives to check in with each other. And that was a great opportunity.
Stressful lives and somewhat isolated lives, right? Like
Yes.
there's most of the folks I think that are working on this stuff are maybe the only person in their state or region that are working on this, and so there's not a bunch of people to bounce things off of or check in with, and that's personally what you're talking about, and professionally as well. And I think it's offered both of those things. And some days is the I think the personal was more helpful than the professional, but both of them valuable, tremendously valuable. You can't get it anywhere else.
So people are hopping online and joining the group and checking in about what's going on with them, and they're feeling safe to do that, to share about what they're up to and what they're going through. What is it about the Recovery Policy Collaborative that would make a space where people would feel safe about being themselves and talking about what's going on with them?
Shelly, this is for you, right? We do, though. You have people in high-level government positions that some of the things that they say in our meeting, I bet you there's no way in a million years they would say in any other space because of, maybe the risk they feel associated with it or the personal disclosure they would never, ever do. But it really has, and I don't think there's many spaces for folks to do that. But you're a government person. I mean, you're going to have a better...
No, I think there's a lot of stigma still. I mean, I didn't say come out as a person who had experienced the system, used drugs, or anything until I was almost done with my government career. I mean, I had a full career just being a bureaucrat or whatever, or an appointee, a normie, I guess, right? And then at some point I was like, this is very inauthentic, like I need to start talking about this. And it opened up a kind of whole world of I think other opportunities to be impactful. But I think there's a lot of people who are still in that position. And I don't think, I don't kind of have judgment on myself around it. I think, it was what it was, but how great would it have been to have a group that I could go to? And I think that was kind of part of it too, wanting to create a space where, people who, like you said, Brandon, these are high level government folks very often, or high level, the face of advocacy in their state. And, to be able to kind of come out and say, listen, I've been struggling. I had a return to use. This is what I'm dealing with. And for people to be like, yeah, me too, or we're here for you, we love you, whatever it is, it's really, really powerful. Because that's something that might feel very shaming in another context, even in the recovery space.
Yeah, that's interesting. So, been able to provide a space for people to really be open and honest about what they're going through and not to feel pressure or stigma about sharing that. And then even in the middle of all of this, the Recovery Policy Collaborative has been able to come together and identify some things to work toward. And so I want to talk about some of that. What are some of the things that, even in the midst of all of the things that folks have been struggling with, that we've been able to pull together and work on?
I mean, I think we've seen quite a few kind of, and this is like on the policy side, formal and informal collaboration going on. Like, I know we do a lot of work where I am now at Georgetown on access to treatment in jails and prisons. And it's been the people in the policy collaborative who are doing that same work around the country that I've kind of plugged into, and like power in numbers, like going to decision-making kind of spaces and together, or collaborating on drafting model laws or reports or whatever it is that I might not have done. I mean, I had a situation where I was working with the ACLU and a few other groups who were bringing a lawsuit in a state on behalf of someone who was going to be denied methadone in jail. And I called Brandon, I called Mike, and I was like, let's get on the phone with these guys, because they had questions about how, how could this work practically. So really kind of pulling from the people in the group. And I've seen it happening, without me, like people working in different states, in state government, collaborating on stuff or whatever it is, to get some things accomplished this year, sharing ideas, sharing what's working, not reinventing the wheel in our little communities.
Yeah, I want to explore that some more, that whole idea of not reinventing the wheel and learning from each other, and then preventing from becoming too siloed out into different avenues. I wonder if we could talk some more about that.
I mean, I think that's one of the main things we aim to do today. Is we've already launched a project focused on silos and how do we align what's going on in different systems, and how do we figure out what's going on that's good out there, and might have been a good idea but goes to the graveyard of good ideas when the money runs out. And how can we kind of take what we see as working to develop a real vision for the system, because there is no vision for the system. There is no, all right, here's the plan. In 10 years, this is what we want it to look like. Right. These guideposts, these principles, this is, what we're funneling all of this.
No strategic plan.
No strategic plan. And I think that's one of the goals of today, not to come up with a strategic plan for the country, but maybe, I mean, to start thinking about what could it look like, and how do we drive towards that?
I mean, there have existed in throughout my lifetime ideals around equity and around access, and a vision for that healthcare utopia in this country, but never embraced as a vision with a strategic plan associated with it. So I guess we got to take a look at what we have, what's within our capacity to impact. And one thing that we can accomplish right away is collaboration to bust down some silos within our own community. Yeah, I found it uniquely helpful in initiatives that I've been involved with, just to check in with folks, what's going on out there.
Yeah, so we've got all these different people that are hunkered down in their own specific areas and dealing with their own different projects. And then COVID happens and forces everyone in front of their screens and basically puts people in the same room that likely wouldn't be otherwise. And so we've got this retreat going on today, and a bunch of people that have been involved with this over the last months that are showing up. And I want to give folks an idea of what types of organizations are represented here, what types of people have become involved in this and are going to be involved in this discussion today.
A broader way. I mean, this we're talking about
Start at the table.
Strategy, right? Yeah, folks that work for advocacy groups and policy organizations. Me, Brandon, George.
I'm Donald. I'm focused on some digital health and community innovation right now.
Yeah, I work in academia, but worked in state government, and I think we have people, from federal government, high-level positions in the federal government,
across the spectrum of interagency,
across agencies, state government, people who are in local county government. Managed care plans, providers. And, the other thing I think that's been really interesting about this group is we have folks who kind of have come through their career and their experience through a recovery lens, or a 12-step kind of focused lens, and then people who come from a harm reduction focus. Mm-hmm. And that's been, I think, a big, I don't know if it's a manufactured rift, but I think there are perspectives that have for a long time kind of been siloed about what needs to be done in this space to address substance use and substance use disorders. And I think that's another unique thing about this group is not only is it both government and external and advocacy, it's also people representing, different philosophies.
Multiple pathways.
Yeah, different philosophies within recovery and
Within
harm
recovery.
reduction as well. Indeed.
Yeah, so let's talk about that. What does that mean? What does it mean to have multiple pathways to recovery?
I think that's been one of the positive consequences of the new recovery movement that started in 2001 with the summit in St. Paul is understanding that there are many people in this country who once had a problematic relationship with alcohol or other drugs and no longer do. And it's not exclusively one pathway, although one pathway may have had the strongest voice outwardly or no voice at all. We're seeing a more unified voice right now. 12-step is present, but non-12 step, secular and non-secular, everything's present as far as I know.
Increasing access too, right? Though you talk about multiple pathways, but making sure that all people have pathways, right? Because it's, folks that look like me have pretty open access to care for the most part. I shouldn't say that, but they have a well-traveled pathway. And other folks, specifically, BIPOC communities that, like you said, were highlighted because of COVID and the inequity there. The data around that's terrible. The access to medication, even with insurance, is like 50% less. It's wild. Anyways, that's policy issue. Those pathways can be cleared out from groups like we have today, working better together, I think.
I appreciate you bringing up this business of many pathways of recovery can come from a privileged lens.
I have many pathways to recovery.
Yeah, I did too.
Right.
I did too. Facts.
So let's talk about what the future holds. I know that things are rapidly shifting. We have a new political landscape that's emerging, new funding streams that have opened up. And if we were to check back in with the Recovery Policy Collaborative, a year, 2 years, 5 years down the line, what would we expect to see? What are some of the things that are on the horizon for this group and for the general concept of people with lived experience being involved with policy and forming a collaborative around that?
Quickly, because I don't have the answer to that, but what I can tell you, what has happened before is that the foci have been diffuse, that the recovery movement has come together, but has had just this laundry list of sometimes even conflicting goals. And I think that one of the values or whatever is that we're going to try to get a focus to come toward, and what that is, we'll learn a little bit more about today.
Right. I think that's the question for today is, and I think, it's really kind of two things. One is about a kind of forward path or vision for the system itself and how we, in our individual kind of organizations or agencies or whatever, can kind of impact that. And then I think too, it's again building a bench of more people, and I'm not talking about people doing like a little training and then doing a lobby day. I mean, people who want to dedicate a career to impacting the system. How do we arm them with what they need to be able to do that? To be able to be invited to, somewhere where decisions are being made, not just to tell their story and everybody claps and then they go sit down and then everybody else, the real experts talk. How can we have more people being involved and engaged and understanding how to impact things from the inside?
In the decision-making process, I think that a lot of folks that are part of the collaborative are part of the decision makers, and they do get to stay around after the story to make it. But we need we need to open those floodgates. And I think what most of us would say is that we had to figure it out on our own for the most part. There wasn't a bunch of professional development around how to do policy. And we need to be, to Donald's point, more intentional about that. There need to be deliberate in finding people that want to do this, coaching them up, giving them the resources, giving them the professional connections to be able to execute in their space, whether that's state, local, federal. But we need more people plugged in and armed and trained to do this.
And the other thing I'll add is a more diverse bench, because still now it's mostly one demographic. Make it, in there, even if it's people with lived experience. And so, how do we truly have everybody represented?
Yeah, that's really interesting. I wonder if we could focus in a little bit more on that. You have all of these different types of mentality about recovery, and you have different philosophies, you have different people with different types of lived experience, and bringing them together in a room could be considered a feat in and of itself. And there's a question that's been on my mind quite a bit and that I've heard folks kicking around, which is, how do you reconcile some of these factions within the recovery community that seem to be fundamentally contradictory? You have grassroots organizations out there that are speaking truth to power. And then you have, other organizations that are more top down maybe in nature. And, how do you reconcile these two seemingly fundamentally contradictory views, which is one is to say that the system needs to be completely revised, and the other is to say that we can take small reform steps in the direction of change. I wonder, we had a pretty interesting conversation yesterday over dinner about how some organizations may have missed the boat on this, or where we might have some opportunity to do something different. I wonder if we might be able to have a little bit of a conversation about that topic.
So we need everybody to help facilitate change. Everybody, grassroots organizations, policymakers, etc. I haven't seen a policy drafted in the street, though. Ultimately, it happens with people and leaders around a table. And so even if it's affected from that end, you still need everybody engaged, and you'll need top level leaders to execute it, I think. And so that's not, again, when I've got somebody aspiring to want to do policy work, I talk about the different ways to have effect on the system, and truth to power and yelling and screaming and bringing noise is needed. It's a critical piece. But somebody that's willing to sit in a room and hammer out details that's going to put it into action is also a skill set that's needed as well. And so having those folks in the same room, actually maybe strategizing and working together instead of acting like they're, don't agree with each other, or my way's better than your way. Like, no, I think that we need everybody. And we got both of those. We got some of those different groups here.
I mean, I would definitely second that there's much more power in working together. I think a lot of people want the same thing and might disagree about the way to get there. And at the end of the day, it's, we talked about, the concept of like not letting the perfect be the enemy of the good. I mean, the reality is often change happens incrementally, and it can be very frustrating, from being out there doing the work every day, banging your head against the frickin' wall, and really kind of being at a loss of why don't they see what I see. But, I think there's also humility needed on all ends, right? In government, realizing that, you don't know everything and have all the answers. And also from outside of government, that maybe we don't see the big full picture. And if we all took a little more time to understand, how to kind of work towards something collaboratively, maybe we would get it done. And that being said, I completely agree that there's a space for, and a critical role for marching in the street, for die-ins, for, being out there rallying. And people are pissed. Yeah. People are freaking pissed, and they should be. And, I think even now, there's nothing like the 1-2 punch of press shame and litigation to drive some kinds of reform. Press shame, I think, probably still remains number one. And, it's hard. Like, I've been the person inside being yelled at, by passionate advocates, having come from being an advocate. And it's a hard situation to be in because you want to respond, you want to do, be responsive. You agree with what they're saying. But sometimes it takes, a minute to get it done, or have to trying to think about like the best way to frame it. I mean, I know when I was working in government, I would call advocacy groups and say, hey, can you guys, make a little noise about this or that?
Write me a letter with 50 signatures.
Yes. I mean, I've almost come out. I mean, and you have to be careful, but I've almost said to people, short of saying to people, please sue us, and, being able to have that open dialogue, though, those behind the scenes kind of conversations, that's a relationship building thing also.
It's a recipe for change too.
Right.
Having people on the inside that can help direct some of the things. Again, to your point, I don't think everybody on the outside always knows that the workings and the levers that can be pulled to actually start balls rolling. And having groups working together to say, hey, this is how to apply pressure. Hey, this is, if you do this, then this will happen. Man, that works so much better together.
It really works so much better together. And it's hard to have that conversation, if it needs to be a dialogue, and so I wish more of that would happen. Because I think at the end of the day, there's a lot of, it's not like people working in government are like this one big evil conglomerate. Like, there are a lot of people working in there who really want to see the same changes that everybody else wants to see. But how to kind of navigate it, it's tough. It's tough to navigate it and create it in a sustainable way where you can find a way to pay for it and, the things that need to be changed. That wasn't like a very crisp answer, but...
No, it seems like a very complex topic that we're touching on.
It's even more complex when we consider funding. Funding that constrains the harnessed anger and mobilization of the nonprofits we're calling upon, and the culture of fear that may exist in bureaucracy. How do we harness our anger and direct it towards deliberate advocacy, when funding streams, we're afraid to lose those. That's a thing. That was an issue, and from well-meaning bureaucracy that wants to fund innovation, but you don't want to risk losing that innovative funding by hollering about inequity. So I don't know. It was a weird space to be. I was definitely on the nonprofit, federal and state funded side, and felt the collar.
Yeah, I want to drill down on that a little bit more, because, when it comes to funding, you can really kind of see where the priorities lie. And, hearing from people on the ground who are saying, look, why does it make any sense for us to try and reform a system that was designed to destroy us? And then looking again at the way that the monies are allotted, with order of magnitude more funding going towards police and law enforcement efforts as to treatment or harm reduction or any of the things that have been shown to and demonstrated to work. So how do we reconcile these two ideas? One, that we should just burn the thing down and start over, or that we can make incremental adjustments and make any progress through compromise.
So that's the dart for conversation today.
Yeah. I just attended Peer Apocalypse, which was in an Oregon national peer conference. A lot of mental health peers, and just some really ferocious advocacy going on. And that ultimately, in the end, was the question that we raised in a group, was burn it down or refine it. And we could not come up with an answer in the session I was in. So I interrupted you.
No.
I was just really present, and did there was a fear that if we burn down the system, would that create harm? And that question itself, we discovered, actually came from a privileged lens. The system is harming. Right. Who's Who's it going to harm if it goes away whilst we're rebuilding it? I don't know. Sorry.
You talk about complexity. You're talking about the last point of it being a complex question with a super complex answer, and so is the one you pose now. Perfect being the enemy of good comes back to mind a little bit, like just in the sense of how, like, I don't want to just sit and wait for it to blow up. Like we need to work now. Like we need to work, and even if it's going to be incremental, like we have to work now. And this blowing up piece, like when's it going to happen, right? Like, can it happen in a year? Will it happen 5 years? Will it ever happen? My experience with most changes, it is incremental. It's not blowing up. Even if we do need to blow it up, it feels like it would be like controlled burns, one area at a time versus a big explosion, if that makes sense.
You seem to be alluding to something along the lines of supporting any positive change or meeting people where they're at. Is that an accurate interpretation?
That's a point I love to touch on. I talk about this with my law enforcement folks all the time, right? We, as people in recovery, we talk about meeting people where they're at, and we talk about any positive change, any changes or any positive changes, step in the right direction. But we expect people that aren't in our space to make these world-shifting views overnight. If somebody has a belief system, I use medication all the time, right? A sheriff that just wants to do Vivitrol, right, instead of buprenorphine and methadone. Well, if he didn't do anything before, do I not work with him just because he's only willing to do one right now? Or am I willing to see that as positive change and try to keep pushing that? So I've had experience with that says that you can get the person all the way over to having all the medications. But telling him he's an idiot because he's only doing one, nothing happens. Like it stops the relationship. It doesn't get anything happening. And so I really think that we need to treat organizations with the same approach that we do individuals. Around this idea of we need to meet them where they're at, and any positive change is good change for me.
I mean, I think we have to do work on a parallel track, right? Like, yes, we don't think that people should go to jail, but there are people in jail right now who are suffering, struggling, don't have access to the type of care or treatment that they need. Should we not focus on getting those changes made right now? Yes, it's an incremental change, but it's the reality as it stands today.
Do we not help them just because we want to decriminalize everything and we don't want people to go to jail? Period.
Right.
Of course
so
not.
I
We
think
help them.
it's a both and.
So I hope you've enjoyed the conversation today. And if you were able to attend the retreat, I hope that you enjoyed that. And please be on the lookout for more conversations of this type coming from the Recovery Policy Collaborative. Thanks for your time today, and hope you all have a good one.